So when we came to Freedom Day and the restrictions, or the legal restrictions around social distancing and even use of face masks had been dropped, what we saw was that there was a bit of conflicting messaging because many grocery stores, TfL, so that's our London transport body, going on the tube, all actually implemented sort of local restrictions that did require individuals to still wear masks. So while it shifted from a federal level, it did then we saw local bodies responding in different ways. And while there has been a decrease that surprised many scientists, as there was predicted to be a huge wave over the August months, we saw a decrease, but still high. That's 25,000 cases a day, which is much more difficult to manage than 2,000 cases per day. But that actual trend is now starting to slow. So the fall isn't continuing to go down. We over the last week, it's now starting to flatten out. But during that time, what has been encouraging, what has also been good news, is that that trend in a number of cases has been also followed in some regions with a fall in hospitalization. So that's a key indicator that this could be a real trend, although there is, as I mentioned, regional variation. So there are still cases in some parts of the country that are going up and hospitalization following that as well. So I think it's still early. We've only really just made it easier to travel. So my suspicion is that in the coming months, in August, we'll see an increase, and I think September will be a real crunch period.
What does it tell us about how effective the high number of vaccinations, the vaccination rate in the UK? What does that mean for how this might be playing out, do you think?
Well, certainly we see that vaccine wall is holding because the number of people that have been infected, that's concentrated mostly in younger adults. So the people who are getting infected, those cases, the majority are now younger. So we do see that the vaccine is still very effective in spite of Delta. So the Delta wave was part of why we originally moved the original Freedom date by a month back to be extra cautious on that front. And now what we're seeing is that the U.S. is experiencing the first, let's say, resurgence of COVID, just as they were starting to see a decline. And that has translated to many young people even being hospitalized in the U.S. In the U.K., it's interesting that the JCVI, which is the vaccine advisory body for the government, has really ruled out the ability for children to be vaccinated, unlike in Europe and US and in Canada. So I think when we see that back to school rush as well, the trend could also then pick up. I think we would have to now consider about the risks and benefits looking at that younger population as well.
So, and that's such a great point. Is it possible in any meaningful way to reach some form of herd immunity, of being able to live with the virus in the community, unless children are eligible and included in the vaccinations?
You've really hit an important part. We need extremely high level of vaccine uptake due to Delta. Delta changed the equation because it's twice as transmissible as the original wild strain of the virus. So we do need to see that younger people are protected. Also because we're still learning quite a lot about how even mild cases are linked to long COVID. Over 2 million people have reported ongoing complications and symptoms even from mild cases. So of course that has been linked to the worst long COVID cases are linked to hospital stays, but not just limited to that. So when we talk about children, we also need to be thinking about ensuring that they have the ability to be protected by a vaccine, but also simple measures. So here in the UK, it's been very popular. Sajid Javid, our health secretary, has said, it is time to live with the virus. But living with a virus doesn't mean doing nothing. And I think if we could take a lesson from what the US is doing with their ventilation systems, air purifiers, things that aren't necessarily very expensive, and equipping offices as well as schools with these, and also really cracking down on vaccination. So they're taking a much harder line approach on mandating for where was previous hotspots. For instance, New York, very urban, and in that region, even to enter a restaurant, you need a vaccine. So I think the pressure in the UK will mount, but we're not going in that direction at the moment.
And Oksana, when you're looking at vaccinations, I mean, Moderna's just been approved in Australia. There's talk about it being used as a booster elsewhere, as a third shot. With regard to the spread of this virus globally, how much more important is it that everyone globally gets at least access to one vaccine before some countries are looking at third and fourth boosters?
Yeah, so Israel is sort of the test case for this, because we see that they have added the first country in the world to go ahead with a booster dose for over 60s and immunocompromised people. But globally, the pandemic is far from over. We see that many low-income countries have only 1.1% of their population receiving vaccines. That includes frontline health workers. So I think that this is going to really shoot us in the foot in the long term, because we're creating environments in which the virus is optimized to mutate because of the high level of community transmission in very large populations. That's the majority of the world. Globally, we've only got about 15% of people covered. So I would actually follow the WHO's advice in this instance to ensure that we're getting at least a baseline coverage globally before we move towards protecting those who are more elderly. And because there are other measures that can be taken. It's not just the vaccine alone. Ventilation, again, we're just not hearing about the push for clean air, which I think is going to be the next frontier of public health.
Yeah, such a great point, and one that's not been discussed enough. Oksana, really lovely to talk. Thanks so much.
Thanks.